Hello, my name is Martin Lipscomb, and today I'm talking to Roger Watson, Professor of Nursing at the University of Hull, founding chair of the Lancet Commission on Nursing, founding member of the Global Advisory Group for the Future of Nursing, and vice president of the National Conference of University Professors. Roger is something of a publishing machine. His wiki page states that he has over 600 publications listed on the Web of Science, and his work has been cited more than 4,000 times. This in itself is no mean achievement, however. Roger is probably best known as editor-in-chief of the prestigious journal Advanced Nursing. And to open up a conversation about research and evidence in the nursing literature, in this conversation, I talked to an editorial that Roger jointly authored in 2020 with Mark Hayter, titled "When Nurses Ignore the Crucial Importance of Evidence." Roger, hello. Please, would you outline the thrust or main theme of this editorial? What was it that you wanted to say?
Okay, well, thanks, Martin. First of all, I'd like to thank you for that very generous introduction. And I'm really pleased to be on what I come to call the Martin Lipscomb Show. I've seen who's gone before me, and I've been very impressed. They've been a good series, and here I am at last. So I'm very pleased to be here. Yeah, thanks for picking up on that editorial. As you say, I wrote it with my colleague Mark Hayter, who's a colleague at Hull and also one of my colleagues on the Journal of Advanced Nursing. And I think it was a couple of things that really prompted us to do it. It was really encountering what I would call positive views about alternative and complementary medicines and traditional Chinese medicines among some of our colleagues and some of our students. And you know, they come through sort of casual conversations, but you realize this goes quite deep. You know, I suffer chronically from a bad back, and if you mention that to someone, you'll get the don't you think you should try osteopathy, or don't you think you should try this or that or the next thing? And we've encountered this with undergraduate students, colleagues, and indeed with some of our postgraduate students. And I think also to sort of cement it in a way, we both work a great deal in China, where traditional Chinese medicine is very prominent. And you know, neither of us would write off everything in that gamut of things that are called complementary, but there are clearly one or two things that just clearly have no sort of mechanism and no sort of biological link. And what we're concerned about, without patronizing anyone, colleague or student, we feel two things. One, that people don't really know how to assess the evidence and put forward an argument for something. That concerns me, whether these things work or not. And the other thing is that we felt, you know, Mark having been a chair for a long time of the NMC investigating committee, and I'm not saying he encountered any cases like this, but we did both wonder, could people be putting the registration at risk if, for instance, we can't stop people believing in things, but if they were presenting in such a way that they were presenting untested treatments or treatments that probably don't work to patients. So we thought we'd write the editorial to see if we got a reaction from colleagues. We didn't really, but also for students to know what they're coming into as a registered nurse. If you're coming in as a registered nurse, you know, you are kind of signing up to certain values, really. And one of those is clearly evidence-based practice. So that was really what we were getting at, yeah.
Okay. For me, in the editorial, you tie being a professional and indeed professionalism to the adoption of a particular worldview. Specifically, you valorize forms of thinking and reasoning that take up what we commonly take to be evidence, and in particular knowledge derived from scientific research evidence. You also point towards ways of thinking and ideas that some nurses, as you've just described, hold, which run counter to science and research evidence. Explicitly, you mentioned, for example, moxibustion and homeopathy, and clearly there's no good evidence to support the contention that these things work in the way that proponents claim. At best, as you note, we might assume that their adherents are gullible. Now, before we spoke, I ran some quick searches, and I've located papers in the nursing press written by nurses that, in addition to those you mentioned, comment positively on subjects such as the laying on of hands and the beneficial power of prayer, and a range of what, to me, are completely wacky, mystical ideas. And Sally Thorne, I know, has recently commented on nurses who support the anti-vax movement.
Yeah.
Now, I take it from what you say that for you nurses who believe in moxibustion, homeopathy, and other kindred forms of silliness, and who are willing or unwittingly allow patients to become aware of their beliefs, these nurses potentially disbar themselves from claiming the title, the authority that goes with being a professional. I believe that's, I'm putting things into words for you, but I think that's where you're going. So that is, if to be a professional, behaviour and advice needs to be grounded on scientific evidence, when purported professionals advance non-scientific beliefs in a professional context, we ought to ask ourselves whether those nurses have relinquished the title of the professional. I think that's what you're saying. Am I correct?
Yeah, I think they're certainly in danger of doing that. I think so. I mean, there's obviously a spectrum of different kinds of treatments, and there's obviously a spectrum of ways in which these things can come up, you know, but we felt that if nurses were saying in the presence of patients what people often say to us, I find something works for me, that can be seen as being endorsing it, which it clearly is, but it's not presenting it in a very coherent or evidence-based way. And of course, many of these treatments are simply adjunctive, and possibly, well, many of them don't have any side effects. That's because they don't have any effects. It's just scientifically impossible to have one without the other. But I think that if they're going to, they've got to think very carefully about how they're presenting these things. And I know locally from oncologists, that they meet people who've completely abandoned, tried and tested treatments, including surgery and chemotherapy and things like that, which have their problems and they don't always work, have abandoned these things completely in favor of alternative medicines, and some of these people die probably as a result of that. So it could be the thin end of a wedge, and a patient could run off with the thinking that, the nurse said they thought this was a good thing to do, and that's maybe as far as it goes. But I think we just have to be very, very careful about how we present and propose these things. And it isn't just in speaking to patients. As you say, some nurses are publishing about these things, and some of them are blogging about them, and people like me sort of counter blog about it. And the argument isn't always against the actual treatment, some of which are clearly unscientific and impossible, but it's more about the how do you know that? Why are you proposing that? What's your evidence to back that up? And I find very rarely are people able to back it up with a good argument. The arguments are usually, I think, as I said earlier, it works for me, or it worked for someone else, and there is a study published that shows it works, and great, show it to me. There's no control, there's no even a before and after. So I just find a lot of flaws in the way of thinking and the purported evidence base in that particular area.
Okay, let me ask you some questions which I think flow on from the position you're advancing. Firstly, what, if anything, does the existence of this literature, a literature which, to my mind, is often irrational, say about nursing?
Yes, it says that we're not, we've obviously not been properly educated or trained, or whatever the right word is, in the kind of thinking that's required to see through some of the arguments. We're not alone in that. I mean, there are medical practitioners and many others who, will adhere to one or other of these things, but not so many. I think within nursing, I don't think we take training. And I use training here, training the mind scientifically and philosophically seriously enough at the beginning, so that you can discern what's potentially a good argument and good evidence, and then to propose that. So I think there's something wrong with the way perhaps that we're being prepared.
Okay. Now, it's known and it's very well documented that many nurses encounter difficulties when reading and interpreting statistics.
Yeah.
Put simply, nurses are perhaps not sufficiently or adequately educated to comprehend the sorts of statistical tests that are used in quantitative papers.
Yeah.
Unsurprisingly, they may therefore misinterpret what's proposed in such papers. Might this statistical illiteracy
Yes.
play into the profusion of non-scientific hokum that your editorial discusses?
I think it definitely does. Seems to be a tradition amongst nurses, particularly in the UK, where most of my experience is in terms of teaching. There seems to be an aversion to statistics. And I'm not sure if that's because of the kind of people who come into nursing who don't want to, they didn't think it would involve something like that or necessitate that. But I also think it's possibly partly the way that we teach it. It's always taught as a sort of separate subject, and in the abstract. And I did a degree in biochemistry for a start, and we did laboratory experiments, and then were shown the statistical tools we needed to work out if that experiment had worked or not. And that contextualized it and made sense. So I think as partly the way we teach it, and we never seem to get it right in nursing. We either have people like me teaching it who are not statisticians, but I understand one or two bits about it, or we have statisticians who completely bamboozle them, and sort of never the twain shall meet. And it is very difficult to teach statistics to classes of nurses. Using abstract examples is always very difficult. They want clinical examples. If you use a clinical example, they start arguing, but that's not real. And you say, well, I'm just using it as an example. So I think it's the way I think it's the way we are as nurses. We want good, solid examples, things we can relate to, and they seem to be few and far between. But there are other things. Sorry, carry on, Martin. Carry on.
I was going to talk about replication studies.
Yes.
For me, these things are linked, but there are very few replication studies published in nursing journals.
Yeah. Yes.
However, we know from psychology that many of their reports cannot be replicated, and this has created something of a crisis in psychology in recent years. Yes. If it's a problem in psychology, it might also be a problem, albeit one that remains hidden somewhat in nursing.
Yeah.
What would you say about replication studies? There aren't many of them.
No, there aren't many of them, and I'm really glad that you've asked me that, because it's something I haven't really. You've given me an idea for the next editorial, but honestly, I think there's not enough replication, and I think there are problems with journals and journal editors saying, "Oh, this has been done before," and people trying to replicate studies and hiding the fact that they're replicating it, and then getting into ethical problems. And I think we're not open enough about the fact that you need replication, particularly of studies that are trying to show a difference between X and Y, because the fundamental problem that we don't seem to understand in nursing, or people who propose some outlandish therapies, is they don't understand the concept of regression to the mean, whereby one day you can test a well-known antibiotic and treat a huge number of people against a control group and find hey presto, 90% of the people in the treatment group get better. You repeat that a couple of years down the line and you find it's the other way around. That's the way science goes. That's the way statistics go. And we have to aggregate the evidence to get some picture of where the real effect lies. But that, of course, evolves over time because you keep adding studies to it. So I think people probably do rely too much on a single study, and they've nothing then to get them thinking, well, maybe that isn't true. That there may be another answer to this. And people like us, and sorry, I'm interrupting again, but people like us in clinical, I was going to say medical, but clinical glass houses have got to be very careful about throwing too many stones around, because many of the things that we do and propose maybe haven't been tested as rigorously as they should. And common sense is often the arguments are brought, well, it's common sense to do this, that, or the next thing, but it's common sense to use antipyretics like aspirin, because we think we know how they work. They stop prostaglandins, it resets that mythical thermostat in the brain and whatever. But lo and behold, when you do meta-analysis of aspirin and ibuprofen and things like that, they don't come out so well. So common treatments often don't survive meta-analysis too well. So difficult for some people to live with that.
Another thing which, and you'll be in your position as editor-in-chief, you'll have perhaps a view on this. In nursing, we haven't moved towards, as far as I'm aware, registered reports or
Yeah.
report registration, where the journal will promise to take the research report, irrespective of whether the findings are positive, negative, or, as they often are, ambiguous, and thereby get round the problem of publication bias, where the reports which demonstrate a strong effect are the ones which are more likely to be picked up.
Yes. Yeah. Well, no, you're right. Well, we are working. I don't want to blow Jan's trumpet too much, but I mean, mainstream publishers like Jan and Elsevier and so forth are strongly trying to, like Wiley, Elsevier, and the main ones are trying to encourage this. And on Jan, we strongly encourage it, not just for RCTs, but for all studies, because you can register on the Open Science Framework for surveys and quasi-experiments and all sorts of things. But we are, you're absolutely right. We haven't grasped this. And I was looking closely at another journal the other day that will remain nameless, but it's quite a prominent journal. And in their guidance, they had absolutely nothing about even consort or trial registration in it. So that, I thought that was quite surprising, actually. But in Jan, for example, we're trying to make sure that all trials are in line with Ben Goldacre's All Trials campaign. We're trying to make sure that all trials are registered, and not just registered, that it's done so prospectively. And we're auditing that, or Richard Gray from La Trobe in Melbourne, he audits that for us every year. And, you know, we are getting better, but we haven't reached 100% yet. So it is an issue. And it's one, of course, it's all trials registration is there to deal, as you said, with publication bias, because people still sort of bury the poor studies away. And commercial companies, apparently, I just read the other day, are not under any obligation, for example, to share all their data from drug trials yet. So there is still an issue out there, but there's no excuse in nursing because we're not dealing with drugs.
Okay,
So it's a good question, good point.
Okay, so nurses aren't prepared, by which I mean educated, perhaps sufficiently to engage with the statistical tests which they would need to understand if they were to engage seriously with research reports in a way which might counter the problem you're identifying with mystical hokum sneaking through into our journals. Can I tie that in any way to our predilection, our preference for qualitative research? We, for very obvious and very sensible and very good reasons, give a lot of attention to qualitative research findings. Do we give too much attention and weight to qualitative research?
Right, I don't really have a straight up yes or no answer to the last point you made there, Martin. But I do think that we carry out too much qualitative research for the wrong reasons. That's my worry with qualitative research. I've not got a problem with qualitative research as such, and I'm really glad to see, meta-narrative, meta-synthesis, and all these things coming in now to try and aggregate qualitative research and give us more of a, not generalizable is not the right word, but more of a picture of what we're getting out of these studies. But I think we're doing too many of them for the wrong reasons. I must get the second part of that sentence in. And we're doing them because, on the whole, as we've already said, nurses have a predilection for qualitative studies because they have an aversion for quantitative studies. But it's still not done for the right reasons. We still, and I know colleagues regularly say this, we still get students, undergraduate and postgraduate, coming to us and saying, I would like to do a qualitative study. That's their aim. It doesn't matter what the question is, they want to do a qualitative study. Even qualitative experts like my co-author Mark would say, well, why do you want to do it qualitatively? And then you see studies that are done, not so much at the postgraduate level, but maybe at the master's level, at the not undergraduate honours level, and you say, well, why did you do that qualitatively and not quantitatively? Oh, I don't like statistics. So those are just not valid reasons for doing qualitative studies. So I still think we do too many for the wrong reasons. But I have to say, I find my qualitative colleagues, and you mentioned Sally and Sally Thorne, Mark Hayter, they really are. I think they're more rigorous about their research than many quantitative scientists, and they really are trying to gatekeep and make sure only the best studies get out into the public domain, because they recognise that a lot of what is done in the name of qualitative research isn't very good. And of course, our mutual acquaintance John Paley would weigh in on that one as well, as he already has on your podcast.
Yeah, I think Sally is doing some really interesting things in Canada, and she's pushing qualitative research in a direction which I don't necessarily see occurring in the UK. Positively, I think, very positively.
Yeah.
Let me ask you a different question though. You've written quite a lot in the past. I know I've left behind your editorial a bit here, but given your position, you've written or you've commented quite often on predatory journals.
Yes.
Is any progress being made at all?
Yeah, no.
Okay. Well, what a beautifully short answer.
The number of let people be in no doubt that the number of predatory journals continues to increase. I mean, since we lost the Beals list, we don't have we've got lists like Cabell's that we can pay for if we want to, but they're hugely expensive. Even the major publishers don't pay for them. But we don't know how many predatory publishers and journals there are. Some people say there's a couple of thousand. The other people say it's in the tens of thousands. I've even seen people saying it's in the hundreds of thousands. We just don't know. These are just hydra-headed monsters, that pop up in all sorts of guises and pester you with emails and are impossible to stop. And all we can do, as far as I know, is strangle them financially, is educate people not to publish in these things, but they do, or they wouldn't keep surviving. So the number of journals keeps increasing. They don't particularly get more clever at luring you in, because the emails are a bit of a giveaway with greetings of the day, esteemed professor, how is your health? That kind of nonsense. But they're there and people still use them. And we still get colleagues who say, wow, I've had an invitation from such and such a journal or a conference, which is the same thing. Should I publish here? And you say, look, just stop a minute. Have you checked Directory of Open Access Journals? Have you checked PubMed? Have you checked Clarivate? Have you checked Emerging Science? It doesn't take you minutes to do these things, basically. So there is a problem, but all we can do is keep educating. There's nothing legally we can do about them at all. Although universities could maybe be a little bit more, give a bit more guidance, and maybe a little bit more carrot and a little bit more stick to some of their staff, who go off and publish in them.
There is perhaps one logical problem in this. Your editorial points towards, let's call it hokum, that appears in reputable journals.
Yes.
I have come across research papers which weren't very good, but were nonetheless okay, which have been published in what I would consider to be a predatory journal.
Yes.
If I was a student accessing work to use for an assignment, it's not necessarily clear that restricting my search to the quality journals stops me finding nonsense, and perhaps I could find what I'm after from one of the dreadful predators. Yes. I think there is an odd thing there.
Very odd, yeah.
Anyway, it's been really interesting talking to you, Roger. Thank you very much for your time. Always a pleasure.
Thank you, Martin. My pleasure too.